Hello and welcome you all. Today we'll see the MCQs in orthopedic physiotherapy. Let's see the first one. Which of the following is the most commonly used manual therapy technique for joint mobilization? Your options are ultrasound, Maitland mobilization, electrical stimulation, cryotherapy. So the correct answer is Maitland's mobilization. The second one, what is the primary goal of physiotherapy in post-fracture rehabilitation? Options are A. Immobilization, B. Pain relief and early mobilization, C. Muscle atrophy, D. Joint stiffness. So the answer is pain relief and early mobilization. Number 3. Which orthopedic condition is characterized by inflammation of the plantar fascia? The options are A. Achilles tendinitis, B. Plantar fasciitis, C. Metatarsalgia, D. Morton's neuroma. So the answer is plantar fasciitis. Number 4. What is the primary benefit of proprioceptive neuromuscular facilitation (PNF) techniques? A. To increase the passive range of motion. B. Improve neuromuscular control and flexibility. C. Strengthen only the large muscle groups. D. Reduce the cardiovascular endurance. So the answer is improve neuromuscular control and flexibility. Number 5. Which of the following is an absolute contraindication for ultrasound therapy? A. Muscle spasm, B. Bone fracture, C. Malignancy in an treatment area, D. Scar tissue formation. So here the answer is malignancy in the treatment area. Number 6. In the lumbar traction therapy, what percentage of body weight is recommended for effective lumbar vertebral separation? A. 5 to 10%, B. 25 to 30%, C. 50 to 60%, D. 80 to 90%. So the answer is 25 to 30%. Number 7. Which manual therapy technique is best for increasing the joint mobility? A. Muscle energy technique, B. Myofascial release, C. Joint mobilization, D. Taping. So the answer is joint mobilization. Number 8. Which of the following is the best physiotherapy intervention for lateral epicondylitis, tennis elbow? A. Repetitive wrist extension exercises, B. Eccentric strengthening of wrist extensors, C. Complete immobilization for 3 months, D. Heavy weight lifting exercises. So the answer is eccentric strengthening of wrist extensors. Number 9. Which special test is commonly used to assess the anterior cruciate ligament injury? A. McMurray's test, B. Leishman's test, C. Thomas test, D. Apprehension test. So the answer is Leishman's test. Number 10. Which of the following conditions is commonly treated with the McKenzie exercises? A. Rotator cuff tear, B. Lumbar disc herniation, C. Hip osteoarthritis, D. Tennis elbow. So the answer is lumbar disc herniation. 11. What is the most effective physiotherapy treatment for Achilles tendinopathy? A. Passive stretching, B. Eccentric strengthening exercises, C. Prolonged immobilization, D. Ultrasound therapy alone. So the answer is eccentric strengthening exercises. Number 12. Which of the following conditions is best treated using the hydrotherapy? A. Rheumatoid arthritis, B. Acute fractures, C. Patellar tendinitis, D. Ligament sprain. So the answer is rheumatoid arthritis. Number 13. Which of the following muscle is primarily responsible for knee extension? Biceps femoris, B. Semimembranosus, C. Rectus femoris, D. sartorius. So the answer is rectus femoris. Number 14. What type of joint is the hip joint? A. Hinge joint, B. Ball and socket joint, C. Saddle joint, D. Pivot joint. So the answer is ball and socket joint. Number 15. Which ligament is primary stabilizer of the medial aspects of the knee? A. ACL, B. PCL, C. MCL, D. LCL. So the answer is MCL, medial collateral ligament. 16. What is the primary function of the rotator cuff muscles? A. Shoulder abduction and adduction, B. Stabilization of the glenohumeral joint, C. Scapular elevation, D. Elbow flexion. So the answer is stabilization of the glenohumeral joint. Number 17. Which electrotherapy modality is most suitable for acute soft tissue injuries? A. Shortwave diathermy. B. Cryotherapy. C. Ultrasound. D. Transcutaneous electrical nerve stimulation. That means TENS. So the answer is cryotherapy. Number 18. Which of the following is the most effective in early stage rehabilitation of shoulder impingement syndrome? A. Overhead lifting exercises. B. Isometric and scapular stabilization exercises. C. Heavy resistance training. D. Avoiding all shoulder movements. The answer is isometric and scapular stabilization exercises. Number 19. Which of the following is not a recommended treatment for plantar fasciitis? A. Taping technique. B. Corticosteroid injection. C. Achilles tendon stretching. D. High impact jumping exercises. So the answer is high impact jumping exercises. Number 20. Which type of exercise is most effective in managing osteoporosis? A. Water-based exercise. B. Weight-bearing and resistance exercise. C. Prolonged bed rest. D. Only stretching exercises. So the answer is weight-bearing and resistance exercises. 21. Which of the following is the primary goal of rehabilitation after a total hip replacement? A. Joint immobilization. B. Early mobilization and strengthening. C. Complete bed rest for 6 weeks. And D. Avoiding weight-bearing exercises. So the answer is early mobilization and strengthening. Number 21. Number 22. Which spinal deformity is characterized by an excessive anterior curvature of the lumbar spine? A. Kyphosis. B. Lordosis. C. Scoliosis. D. Spondylosis. So the answer is lordosis. Number 23. Which of the following is contraindication for total knee replacement rehabilitation? A. Pain relief. B. Active infection. C. Range of motion exercises. D. Strength training. So the answer is active infection. Number 24. What is the most commonly affected tendon in decurvens tenosynovitis? A. Flexor carpi radialis. B. Extensor pollicis brevis. C. Flexor pollicis longus. D. Pronator teres, a closed fist. So the answer is extensor pollicis brevis. 25. A 45-year-old patient with frozen shoulder should be treated with which of the following physiotherapy treatment? A. Strength training exercises only. B. Immobilization for long-term pain relief. Active and passive range of motion exercises. D. Complete bed rest. So the answer is active and passive range of motion exercises. 26. Which of the following is the most commonly affected muscles in rotator cuff injuries? So A. Supraspinatus. B. Subscapularis. C. Teres major. D. Serratus anterior. So the answer is supraspinatus. 27. A patient with lateral epicondylitis, tennis elbow should avoid which of the following activities? A. Wrist flexion exercise. B. Repetitive gripping and wrist extension activities. C. Shoulder strengthening exercises. D. Core stability training. So the answer is repetitive gripping and wrist extension activities. 28. Which technique is commonly used for muscle re-education in post-surgical knee rehabilitation? A. Neuromuscular electrical stimulation. B. Cold pack. C. Traction. D. Ultrasound therapy. So the answer is neuromuscular electrical stimulation. 29. Which of the following exercises is most suitable for early stage rehabilitation of an ACL reconstructed knee? A. Squats with heavy weight. B. Open chain knee extension. C. Closed chain exercises like mini squats and step ups. D. High impact running drill. So the answer is closed chain exercises like mini squats and step ups. Number 30. Which manual therapy technique is most effective for relieving symptoms of carpal tunnel syndrome? A. Myofascial release. B. Neural mobilization. C. Deep tissue massage. D. Static stretching. So the answer is neural mobilization. 31. Which of the following is a secondary function of the hamstring muscle? A. Hip flexion. B. Knee flexion and hip extension. C. Knee extension. D. Plantar flexion. So the answer is B. Knee flexion and hip extension. 32. Which of the following is the most common type of arthritis affecting the weight-bearing joints? A. Rheumatoid arthritis. B. Gout. C. Osteoarthritis. D. Psoriatic arthritis. So the answer is osteoarthritis. Number 33. The Thomas test is used to assess the tightness of which muscle? A. Gluteus maximus, B. iliopsoas, C. Rectus femoris, D. Hamstring. So the answer is iliopsoas. So thank you very much for your patience listening. Thank you.